Welcome to Samba Samba. Enjoy the video.
You start with clean hands and a measured saline. 5 teaspoons salt dissolved in 1 cup, 240 ml warm water. Use fine sea or plain table salt. Do not use scented or iodized mixes with additives. Once mixed, cool to lukewarm, you want comfort, not shock. Make sure to do a patch test behind your ear and wait 24 hours to check for sensitivity. If the test is fine, proceed to cleanse your face with a gentle cleanser so the saline contacts skin directly. Once your saline is prepared and your skin is clean, apply it using a soaked cotton pad or a small spray bottle for even coverage. You should hold the solution on each area for about 30 to 60 seconds, using light circular motions to lift debris. Do not scrub. Make sure to keep the solution away from eyes and avoid using on deep open wounds. If treating blemishes, dab gently rather than rubbing, because friction can irritate and worsen inflammation. Finish by rinsing your face with cool or lukewarm water after 1 to 2 minutes and pat dry. Do not rub. Immediately follow with a light, non-comedogenic moisturizer. If it's daytime, add SPF to protect newly treated skin. Use this saline routine no more than once daily and reduce frequency if dryness appears. If you experience stinging, redness, or peeling, stop use at once. Dilute the solution to 0.25 teaspoon per cup for future attempts, and consult a dermatologist if symptoms persist.
Thanks for watching. Consider subscribing if we helped you.